Right, well, Gift of the Givers is setting up COVID-19 testing stations to ease the burden on public healthcare facilities. The test is at a reduced cost. Let's find out more now from the NGO's director, Dr. Imtiaz Suleiman, joining us via Skype this evening. Dr. Suleiman, good evening, and thanks so much for your help. Can you clarify for us, are you setting up one station or various stations?
Good evening, Rebecca. We started off at one station last week, Monday, and that was a test station. But the demand is coming in from various parts of the country. That station is in Mayfair West, but now we should be in this week running in Roshni, in Durban. There's calls from Cape Town, Pretoria, Pietermaritzburg, and other parts of the country. But we have to make sure that each one works properly and thoroughly in terms of contamination, the neighbors not getting upset, following the NICD rules, making sure there's enough test kits. So there's a whole lot of rules to follow, and that's why we're doing one at a time.
All right, explain to us, Doc, how this will actually work. I mean, how do I come to you? What proof do I need? Would I have had to go to a doctor before this and then come to you for testing? What is the process to be tested at your stations?
There's different processes. In some cases, you'll go to a doctor, and the doctor will say, okay, I don't mind taking the specimen from you. And then he'll send the specimen to our center, and from there we'll send it to a lab in Durban. The lab is SANUS accredited, and it's accredited by NICD to do the testing for what is called the PCR, the virus antigen itself. And the other option is that the doctor will say, no, it's a risk to his patients in the clinic. It sends you to us, and our teams there then do the swab for you and send you away. At the moment, we're doing it in a building in Mayfair West, but we're trying to change the setup where you do it in a car park. So that way, you don't get out of the car. You stay in the car, you swab, there's less contamination, less chance of risk to anybody else. Your question is, how do you come? There's two main points. One, have you come back from a high-risk country recently? Do you have symptoms? If you don't have symptoms, go back home and stay in quarantine till you get the symptoms and you come back. Secondly, have you contacted somebody else, in contact with somebody else who was positive? Same question. Do you have symptoms? No, stay at home for 14 days, till you have some symptoms in those 14 days, and you come back. But with that, I like to add a third proviso, that you may not have come from a high-risk country, from somewhere else in the world, but you may have traveled through Dubai, the airport. And in that airport, there could have been contact with people who come from high-risk countries. So if anybody has traveled to Dubai, my own impression is that if they get symptoms, they should come for a test.
All right, so it sounds to me like that's going to be the equivalent of drive-through testing that we've seen happening successfully in other countries. So I see here in what you've released, you're looking at the Dome in Randburg and at using the undercover venue and parking facility. So when will we know, when will you confirm where this will be happening? Because you say Roshni, also your second site. When will details be available to the public?
No, we looked at the Dome. It's about too big a venue. So we decided not to use it.
Okay.
We needed something smaller. So we're going to be using something. We've got two venues in Joburg tomorrow, which we're looking at, because there's a lot of factors. We're very appreciative if they offered that venue to us. It's very, very big, so it's not ideal for us. We just want something much smaller, but we'll announce those new venues soon.
All right, so what would be the cost of being tested with you rather than going the whole hog or going to a lab?
Well, it's not so much my test, we're just facilitating, because Gift of the Givers can't charge for things that we do. It's cost 750 Rand. One of the reasons, there are several reasons why we put up the test. One was there's a backlog for tests for almost 7 to 8 days now. The labs can't cope. Secondly, we don't want people to go to the government services, because you can fly overseas, surely you can afford to pay for the test yourself. So we want to take the burden off the health services and tell you to pay. But then when we tell the people, they say, but the test we're going for is between 1,000 Rand and 1,600 Rand. It's too expensive if 3 or 4 family members have to go. So then we spoke to different service providers, and we managed to bring the test down to 750 Rand. We're trying to hold it to that price. Right now, the final laboratory that tested just put their price up. They said the currency exchange rate forced them to put a price up, and because of the demands of the kits, which are in short supply worldwide, the prices for that and everything else is going up.
Okay, so Doc, obviously you have to work with all of that. So would it be possible for you to give us some idea of when you might finalize your plans?
Well, the first one is already working. It's 6 days now in Mayfair West. Hopefully, we think Roshni will be starting tomorrow. We also have to stay to observe how we run it and all the pitfalls and the difficulties. The other reason also we're not rushing is because the kits are running out. And we can't take people's specimens and then hold them for 3 or 4 days before we test them. It won't be very valid. But by 1st April, there may be a breakthrough. The FDA in America has approved a new type of cartridge that also does the PCR testing. And the people that we work with have that machine. If that comes through, and those kits come through, we can actually test 16 specimens in 45 minutes. And if you have 3 machines like that, you save 24, 48, 72 hours, and you'll have 48 specimens done every 45 minutes. And when that happens, we can then increase the number of testing sites in the country.
All right, great stuff. Thanks. Great work as always. Gift of the givers. And yes, that kind of testing could be the difference between, this exploding throughout the country or us just getting it under control. Still to come.